Have you ever wondered why your group health plan seems to rise every single year? It's one of the most common frustrations I hear from HR and finance leaders. The truth is that renewal increases, they're not random. Those increases are driven by several key factors. Those are medical trend, large claims, and the rising cost of prescription drugs, especially specialty medications like GLP-1s. Then you add in network discounts, administrative fees, and stop loss if you're self-funded. And suddenly, your costs look very different from the year before. But here's the challenge. Most employers, they only see the percent increase on the renewal. What's missing is the why behind it. Without understanding which line items are driving those increases, you can't know what's negotiable, what's a one-time shock claim, and what can actually be controlled. So let's break it down by funding type, because what drives an increase looks a little different in each model. For fully insured plans, carriers blend your group into a bigger risk pool. So what that means is your rates are based on a community trend. Often, medical inflation is baked in, plus adjustments for your group's age, location, and industry. Large claims don't always fall off right away, so a high cost claimant this year could keep driving your premiums for another year or two. Administrative load and pooling charges are hidden into the rate, so you don't see the line item detail in your rate, just the top line increase. For level funded plans, here, your increase is tied closer to your own claims experience. If claims are running higher than the monthly funding built into it, the carrier adjusts future rates upward. Stop loss coverage is bundled, so renewals may rise if you had large claims that year, even if they were one-time claims. The good news, though, is when claims run well, you can often receive a surplus back, helping offset future increases. For self-funded plans, you pay actual claims plus fixed cost. Increases are driven mainly by stop loss renewal pricing and underlying medical and pharmacy trend. If you had large claims, your stop loss carrier may add lasers or higher premiums. But unlike fully insured, you have real transparency. Monthly reporting that shows exactly which conditions or drugs are driving cost and where interventions can make a real impact. The good news is you do have options. With the right reporting and strategy, you can identify cost drivers early, explore funding alternatives, and take steps that create long-term stability instead of year-to-year surprises. So, if you're looking at your next renewal and asking, why does this keep happening? The first step is digging into the numbers behind the increase, not just accepting the headline percentage. I help HR and finance leaders do exactly that. Cut through the noise, understand the drivers, and put a plan in place that works for both the business and for your employees.